Let's take a look at the Rem Meridian now. The Rem Meridian is the meridian which runs down the center of the front of the body. It's paired with the Du Meridian, which runs down the center of the spine. They both begin in the perineum. We won't look at the points in the perineum, but we will look at the major points along most of the meridians, including the Rem Meridian. So while we're at the Rem Meridian, I also want to take this opportunity to talk a little bit about making measurements and finding out where acupuncture points are on the abdomen and on the chest. So let's take a look at Monique's abdomen here and her chest, and we'll take a look at these points and see if we can't get a little bit more guidance as to how to find points here. The first thing to think about is that the Rem Meridian describes the center line of the body. And there are certain distances that we want to consider that we'll use as landmarks when we're talking about the abdomen. So, for instance, we'll begin here at the sternocostal angle. From the sternocostal angle to the belly button is defined as being 8 divisions. And the belly button is Ren 8. It's in the center of the belly button. And at the sternocostal angle is Ren 16. So between them, halfway, we find Ren 12. They just happen to be 1 point every sun. That's not the case in all situations. If we look below the belly button and we look from the top of the pubic bone, and I'm going to ask Monique, would you please touch the top of your pubic bone for me? Thank you so much. So from the top of the pubic bone to the center of the belly button is described as being 5 divisions. But less important, or more important than the 5 divisions, is the fact that there are muscle bundles in between the top of the pubic bone and the belly button, which actually describe or show us the location of some of the more important points along the Rem Meridian. Ren 2 is described as being just at the top of the pubic bone, and it's a very important point used for many problems in the lower warmer. Ren 4 and Ren 6 are also very important points. So when we look at the lower abdomen, in their own right, Ren 2, 4, 6, and 8 are important and versatile and useful points, but they're also very good points as landmarks for us when we're finding points which lie off of the midline, but may lie at the level of one of these other points. So we'll look at Ren 2, Ren 4, Ren 6, Ren 8, Ren 12, Ren 16, is at the sternocostal angle. Ren 17 is the next point, which is in the middle of the sternum at the level of the 4th intercostal space. And Ren 22 is in the supraclavicular the suprasternal notch. And Ren 23 is just above the hyoid bone. Each of these points are needled perpendicular to the skin, with the exception of Ren 17, which is needled at a transverse or a transverse oblique angle, never directly in. I think that we also want to take a look at the side-to-side measurements on the abdomen, in addition to measuring by traveling over a muscle bundle, again, over a muscle bundle or into a valley. Remember, the word point is a misnomer. When we're looking for points, they're not points so much as they are valleys, or places where the energy kind of draws our finger in as we travel along the meridian. So when we move from Ren 8 to Ren 6, we simply go over a muscle bundle and fall into Ren 6. We go over another muscle bundle and fall into Ren 4. And if we move down, we hit the top of the pubic bone, which is another natural stopping place, and we hit Ren 2. We find the same thing when we move lateral to find other meridians, for instance, the kidney meridian, the stomach meridian, or the spleen meridian, which lie off the midline. We can travel over a muscle bundle and end up here, in this case, 4 divisions from the midline. And 4 divisions from the midline is also described as being the midclavicular line. So if we find the middle of the clavicle, and on men it's also the nipple line, right? If we find the middle of the clavicle and we come down, we are at the 4 division line. And if we follow all the way down to the lower abdomen, we find that it's just on the sides of the rectus abdominis. Right. Now let me show you how to find these points and to needle them. Well, let's begin at Ren 2 and proceed up to Ren 23. And we'll put a few of these needles in as we go along. So Ren 2 is, remember, just on the upper border of the pubic bone. When needling points on the lower abdomen, we need to be careful that we don't needle too deeply. 1 sun is pretty much the maximum depth for most of the points on the lower warmer. A woman or a man with a full bladder, you could easily penetrate the bladder with a needle insertion that was too deep down here, especially if you have a thin patient. So we need to always be cautioned there. Ren 2 is at the top of the pubic bone. Ren 8 is in the middle of the belly button, and it's forbidden to needle. We do treat it with moxa, however. Ren 6 is just under the first muscle bundle, and Ren 4 after the second muscle bundle. So easily found. Ren 2, Ren 4, Ren 6, Ren 8, Ren 12, halfway between the belly button and the sternocostal angle. Ren 17, located at the fourth intercostal space, needled at a transverse or a transverse oblique angle. And the final point that we'll needle is Ren 22. In the suprasternal notch. There we go. The last point that we mentioned was Ren 23, and we can continue on. The Ren Meridian continues on up to the mouth as well. I think that covers the Ren Meridian reasonably well, so let's move on to the next meridian.